Welcome back, everyone. We're now going to cover some other leading chronic diseases in the United States, starting with diabetes. So diabetes is a disease that's main characteristic is the inability to use a hormone known as insulin. Now, insulin is a storage hormone. It gets produced by the pancreas to help us store glucose, often or commonly referred to as blood sugar. So when you eat foods, those foods get broken down into sugars, and that sugar gets transmitted into your blood to then be shuttled off to various parts in your body to be used for energy, for the creation of ATP, you'll recall. So insulin helps our body do that. It helps shuttle that glucose or the blood sugar to our cells, and it helps bring it into our cells for energy. It also, if we don't need the energy in that moment, insulin can help us store that blood sugar either as glycogen, the storage form of carbohydrate for later, or if we've gotten a little bit too much, more than we need and more than we have storage capacity for, it can convert it to fat and store it in our fat tissues as well. So this insulin is really key for moderating our blood sugar levels. Your body likes to have a nice narrow blood sugar range for health. Too low and it's dangerous, too high and it's dangerous. So insulin gets pumped out from the pancreas in response to what and how much you eat to keep those blood sugar levels and also your energy levels stable, because insulin helps bring that blood sugar into your cells for the creation of energy. Now, insulin responds most highly to carbohydrate foods, a little bit to protein foods, and not as much to fat foods. So this is really helping to break down carbohydrates carbohydrates are broken down into glucose. Insulin's really helping to deliver that glucose to your cells. Now, the interesting or the thing about diabetes is it either is you're not responding to the insulin or you don't have enough of it in the two primary kinds. So our normal fasting blood sugar range, meaning that if you haven't eaten any food yet and you went to get blood work done, that normal range is 70 to 100 milligrams per deciliter. That's the healthy range for our body. As that number starts to creep up, it means that insulin, for some reason, is not doing its job. I'll move this so you can see the little cartoon. Insulin's not doing its job getting that blood sugar into the cells. And so it's being left out in the blood vessels to float around in the blood, and that level is getting too high. And if you think about a solution of fluid that has a lot of sugar in it, you might think of it as sticky or viscous. Think of something like honey. And that's what you can think of as occurring with the blood and why it's so dangerous. The blood flow doesn't move as easily. This can also contribute to the development of things like plaque, and it means that blood and oxygen can't get to our tissues as easily as we would like it to. So 100 to 125 milligrams per deciliter is considered pre-diabetes, and then 126 and above is one indicator of having diabetes. Now, there are a couple various types. Type 1, type 2, and gestational diabetes are the main ones. We'll look at type 1 and type 2 here. Gestational diabetes is diabetes that occurs only during pregnancy. So a woman's insulin sensitivity changes during pregnancy, and sometimes diabetes can occur just during pregnancy. And this is dangerous both to the mom and the baby. So it's an important condition to, your doctor will check you for it if you are pregnant. It's an important condition to work with them to manage. But let's look more at type 1 and type 2. So type 1 diabetes is considered an autoimmune disease. And this means that it's a self-inflicting condition. So it's involved in the immune system over-responding and attacking some of the body's tissues. So you can think of things like eczema or psoriasis, which are skin conditions. Those are skin autoimmune conditions where the immune system overreacts and it leads to skin disorders. Diabetes, type 1 diabetes, is an autoimmune condition that impacts the pancreas. And this used to be called juvenile diabetes because it often starts in childhood or adolescence, but it's not anymore because adults can get it too. At any time, it can be because of a virus or some other condition. Your immune system can attack your pancreas and reduce its ability to produce insulin. I actually had a friend who developed type 1 diabetes in her mid-20s very suddenly while in the Peace Corps in Costa Rica. And I've had many students in classes, in fact, who developed it in adulthood as well. So it can be developed in childhood or adulthood. And the key here is that the pancreas cannot produce insulin. So insulin just isn't available to bring the glucose into cells. So because of this, people will feel really tired because they just can't get the energy they need from the foods that they're eating. They may also experience weight loss, frequent urination, and extreme thirst because it will act as a diuretic as well, or a diuretic side effect will occur. So this is with uncontrolled type 1 diabetes. The only treatment here, there's no lifestyle modification that will get rid of type 1 diabetes or reverse type 1 diabetes, because it's this autoimmune condition that impacts the pancreas's ability to produce insulin. Individuals have to inject the hormone insulin on a regular basis. So you'll often see individuals with type 1 diabetes regularly checking their blood sugar levels and then injecting certain amounts of insulin before or after meals. The same way that our pancreas would pump insulin out, they have to inject it because their pancreas doesn't do that. The more common type of diabetes is type 2 diabetes. And this is not when your body can't produce insulin, but it's when your cells become insensitive to insulin because they've been experiencing too much of it for too long. So what exactly does that mean? Why would your cells do that? So if somebody is eating a diet really high in either refined carbohydrates or just high in too much food in general, that means that they're constantly getting these big blood sugar spikes. Their insulin is then spiking as a reaction to that and saying, oh gosh, whoa, way too much blood sugar here. We need to moderate this level back to a level that's safe and healthy for us. So the insulin gets pumped up, blood sugar drops, then you eat some more, and then the insulin gets pumped up and blood sugar drops, and you end up in these big spikes and dips, as you see here on the right. This will not only lead to a spiking and dipping insulin level, but it will lead to spiking and dipping energy levels and spiking and dipping hunger levels, making someone more hungry over time. So because of this constantly high insulin, your cells become less receptive to it. They basically start to turn off their receptors for responding to insulin. So insulin keeps showing up at the cells and saying, hey, I have more blood sugar to give you. Hey, I have more blood sugar to give you. And eventually the cells say, stop, I can't fit any more blood sugar in here. I don't have anything else to do with this blood sugar. I can't take it. I'm going to tune you out. And now all of this blood sugar is floating around the blood, which we've already covered is dangerous to our health. So in this case, even though insulin is available, it's not necessarily that these people need to inject insulin. They have it. It's just not having the normal physiological effect that it should on cells. And so the blood sugar is rising in the blood and causing damage. This is type 2 diabetes, and this accounts for 90% of the diabetes cases in the United States. Now, this type, it can't be cured with a pill, but it can be managed. So there are certain drugs that can help lower blood sugar levels. And there are also lifestyle factors that can help as well. So regular physical activity, even getting out and taking a walk after eating, can help lower blood sugar levels. Exercise opens up a specific transporter for blood sugar into cells that's not dependent on insulin. Only exercise does that. So it can really help cells continue to take up glucose even when they're not responding to insulin. So a 10-minute walk after a meal actually makes a difference. Other lifestyle factors that help are balancing your nutrition throughout the day. So it doesn't mean that you have to cut out carbohydrates so you're not getting these glucose spikes, but it's a good idea not to eat carbohydrates, especially simple carbohydrates, by themselves. So this is the idea of nutrient pairing, or like we talked about, that P2F model. You want to make sure that every meal and snack has at least 2 of these: protein, produce, or healthy fats. That's because produce contains a lot of vitamins, minerals, and fiber. Fiber will help slow down the absorption of glucose a little bit. And then protein and fats take a lot longer to digest, and that will help slow down the absorption of glucose as well. So the slower that this glucose enters your bloodstream, the better your body is able to respond, the less your blood sugar rises and less insulin you need to bring it back down. You want this nice stable blood sugar level throughout the day as much as is possible. So regular physical activity and making sure you're getting enough protein, produce, and healthy fats in your diet. Kicking me out of here again. Okay. So risk factors for type 2 diabetes. Who is at risk? Some things you can change, some you can't. The older that your age, over 45, less physically active you are. If you have a family history of diabetes, that'll increase your risk. High blood pressure increases your risk, excess weight. And then if you've had gestational diabetes, you're more likely to develop diabetes in the future. So we know that we want to control the risk factors that we can, those that we've just discussed. Okay, let's move now into cancer, the second leading cause of death in the world. Cancer is a group of diseases that occur when we have some kind of abnormal cell growth that happens uncontrollably in almost any body tissue. So you can have lung, stomach, oral, cervical, breast, testicular, bone, right? Almost any bodily tissue can have this abnormal and uncontrollable growth of cells. And where cancer becomes very dangerous is when the cancer cells metastasize, meaning that they spread from one area of the body to another, which is the major cause of death behind cancer. And these abnormal cells basically wreak havoc or limit the regular function of the cells and tissues that they're impacting. And they can travel in the body through blood or lymph tissue to affect other sites. So there are some risk factors that can increase our risk of developing various cancers. There are quite a few different what are known as carcinogens. These are cancer-causing agents. And the first thing, of course, to know is just genetic predisposition. Sometimes you can do all the right things and still develop cancer. My dad, in fact, is a great example. He's a pretty healthy guy. He was a PE teacher for 40 years and coach, and he has developed quite a few types of cancer, most notably brain cancer a few years ago, despite leading a really healthy life. So there are some things out of our control. There are certain genetic predispositions that we can't control, but there are some things that we can do. So let's look at some of the major risk factors or lifestyle factors that increase our likelihood of developing cancer. Tobacco use is a huge one, and it's not just lung cancer, oral cancer, throat cancer, mouth cancer. So cutting out tobacco use or even down on tobacco use can help. Physical inactivity is a huge contributor to increasing cancer risk. So getting regular movement in, walking counts. Any movement is good movement and all movement counts. So getting regular low-level movement in. You'll learn about that more when we talk about our blue zones. Poor nutrition, which we've discussed. So the increase in ultra-processed food, especially refined or processed meats, carbohydrates, and seed oils, those are things found in packaged and processed foods. I'm not saying you could never eat those, or if you eat a bag of potato chips, it's going to cause you to get cancer, but just increasing our anti-inflammatory foods. This is the anti-inflammatory food pyramid from Dr. Andrew Weil. You can look at it here. Many of these things are shown to decrease inflammation in the body, which can decrease the risk of developing cancer, particularly fruits and vegetables that are rich in various polyphenols and other compounds that have anti-inflammatory effects. Excessive sun exposure can increase the risk of developing skin cancer. We often forget about the fact that viruses and other infections can cause cancer. So we talked about the human papillomavirus, HPV, which is a sexually transmitted infection that can cause cervical cancer. And even mono, the Epstein-Barr virus, can increase the risk of developing certain cancers. Exposure to chemicals and toxins or environmental pollutants, either in the food, water supply, or maybe the buildings that you're in. Things like asbestos in old buildings can increase the risk of lung cancer. And then even certain medications, particularly those that modify hormone levels. So there's some data around birth controls or hormone replacement therapy potentially increasing certain types of cancer in women. So lots of potential exposures and carcinogens, some things within our control, some without. Signs and symptoms to be mindful of. There are so many different types of cancer that affect different parts of the body that we can't label all the signs and symptoms in particular. And oftentimes these symptoms will be similar to other conditions as well. So it might be one of these things, you might think, oh no, that it's cancer, but it could be something totally unrelated. But things you want to generally look out for, especially if they're unusual, persistent, meaning they go on for a long period of time, and you can't remember anything that caused the onset. Things like prolonged pain with no cause, new lumps or swelling in the body. So thinking about like checking breast tissue for lumps, extreme fatigue, major weight change without any known cause, belly pain, nausea, vomiting, or change in appetite or taste, unusual bleeding or bruising, headaches with no known cause, skin changes, or bowel or urinary habit changes. So any major pain, fatigue, nausea, dizziness, or changes that you can't describe the reason for. And the best thing that we can do here is getting regular screenings. If you click this link, it'll take you to a list of regular screenings to get for men and women and at what particular ages. Okay, let's finish by reviewing a few other common chronic conditions. Lung disease. So lung disease includes a variety of chronic conditions that impact the lungs, like asthma or chronic obstructive pulmonary condition. Asthma is often congenital, but can be worsened by environmental factors. So asthma occurs when some sort of irritant causes the lungs' airways to swell and constrict, which reduces or restricts oxygen flow to the body. So this can be really scary for individuals. Again, it often is congenital or occurs in youth, and sometimes people grow out of it in adulthood, but sometimes they don't. This can be triggered by cold weather, environmental toxins or exposure, exercise, or even stress. And then we also have COPD as a group of conditions: chronic obstructive pulmonary disease, chronic meaning long-term, and then some kind of obstruction to regular lung functioning. The biggest two of these are emphysema and chronic bronchitis. And emphysema, bronchitis is a swelling or irritation and inflammation of the lining of the lungs. And then emphysema is damage to the alveoli, the small sacs that take up oxygen. And the primary leading factor behind this is tobacco use. Okay. Sorry, it keeps bumping me around here. Osteoporosis. Osteoporosis is a bone disease marked by thinning and brittle bones. Again, just like all of our chronic conditions, it develops gradually, and over half of Americans above the age of 50 have the disease or early signs of it. So you can see normal, thick, dense bone there on the left, and then as osteoporosis occurs, the bones become thinner and brittle, which increases the likelihood of breaking a bone, particularly in the wrist, hip, or back. So some of the risk factors include being female. Females are much more likely to develop osteoporosis because of our hormonal profile, being older, and getting a reduction in estrogen or testosterone levels related to aging, having a close relative with the disease, and people of Asian or Caucasian descent are more likely to develop osteoporosis as well. Okay. So some things you can do to reduce your risk: weight-bearing exercise, meaning weight lifting. That puts stress on the bone, which causes the bone to build back stronger and denser. Getting enough calories, calcium, vitamin D, and I'll also include protein there. It's really important. If you're in a calorically restricted state, like we see in anorexia, osteoporosis is one outcome there, both because there's not enough calories to build the new bone tissue, and also because of the changes in hormones that are related to that. Calcium and vitamin D are minerals and vitamins that work together to develop and build strong bones. So you can think of things like dairy or even leafy greens, nuts and seeds for your calcium. Vitamin D, you might think of the sun, or even supplementation if your doctor recommends it. Avoiding tobacco use, and then limiting caffeine and alcohol, as that can cause a leaching of calcium from the bones to balance the pH level of the body. Arthritis is a group of diseases that involves joint inflammation and pain. That can be, you might hear people say, oh, I have arthritis in my knee or in my hip or in my shoulder. And the two major types are osteoarthritis and rheumatoid arthritis. Now, rheumatoid arthritis is an autoimmune disease that's triggered when the immune system attacks the healthy tissue lining a joint. And so that cartilage lining the joint gets eroded, causing pain when the two bones rub together. There are certain medications for this. And the more common kind is osteoarthritis, which is just the breakdown of cartilage. That's that squishy substance on the end of our bones. Just that breakdown of cartilage over time due to repetitive movements, injury, past injury. So maybe if you've been in an accident, you might develop osteoarthritis over time. Excess weight or muscle weaknesses. These can also contribute to the development of osteoarthritis. So what can you do to reduce your risk? Well, again, there are some things outside of our control, like age as you get older, or genetics. You can't control those. But things like excess weight, muscle weakness, limited activity. It might seem like exercise would worsen it, but in fact, research shows that exercise, gentle exercise, helps even when you already have arthritis. And then seeing a trainer or a movement, someone that can help you with your movement around incorporating appropriate movement patterns for exercise. And then if you work in a place with similar overuse patterns or develop an injury, those can be risk factors as well. So things that you can do is avoid high impact or hard hitting surfaces like running on pavement, vary your sports motions. So play a variety of sports or do a variety of different movement patterns in different planes, and just move regularly. It shouldn't hurt. If it hurts, you need to ramp down the intensity. If you have arthritis or not, it shouldn't hurt. And avoid hard-hitting surfaces. For individuals who already have arthritis, warm water can really help. So things like water aerobics can be great strategies, or even using resistance bands that have low intensity. So our major takeaways wrapping up our coverage of major chronic diseases are, again, that chronic diseases make up the top, or 7 of the top 10 leading causes of death in the world and account for 70% of the deaths in the United States. These diseases are related to the lifestyles that we perform or don't perform that contribute to systemic inflammation and the development of things like plaque, high blood pressure, high cholesterol, and high blood sugar that lead to all of these other conditions. Another important thing that we didn't cover here, because we've already covered psychological health, is that this inflammation also impacts your brain. So it's not just your body tissues and other systems that we've covered, but individuals with depression have been shown to have 30% higher brain inflammation levels than individuals without depression. So these lifestyle behaviors that we've talked about don't just improve your physical health, they improve your mental health as well. And we'll talk about that more in our final lecture. So briefly, things to limit or avoid tobacco use, limit excessive alcohol use, 1 to 2 drinks a day, and limit the refined carbohydrates, oils, meats, and sugars in your diet. I'm not saying to never eat these things, and perhaps it's even more helpful to think about what things to include before you think about taking those out. So you want to include fruits and vegetables, tubers, things like potatoes or sweet potatoes, whole grains that you enjoy, things like rice or whole grain breads or beans would be vegetable. Unprocessed meats and proteins. So that could be things like steak, fish, chicken, eggs, tofu, and then we can include lentils and beans in that category as well. The key is you want to eat the unprocessed version. So you don't want to be focusing on bacon, hot dogs, cold cuts, and healthy fats, things like avocados, nuts, seeds, and olive oil. These things should build up the base of your diet. And then you can add the fun foods in after that, but they shouldn't make up the biggest portion when you're looking for your long-term physical and psychological health. Of course, you want to get regular physical activity. The guidelines are 150 minutes per week of moderate activity, but really for health, you want to at least get some kind of low-level movement or some kind of movement 3 times a week for 30 minutes. If you can get more, that's great. Start by walking. Everything counts. If you can get a 10-minute walk in after a meal, perfect, build from there. And then lastly, when it comes specifically to the chronic diseases, regular doctor's visits are key. That's how you're going to catch these things like high blood pressure, high blood sugar, and high cholesterol before they contribute to the development of major diseases. Lastly, please tune in to our final lecture on the blue zones, where we dive more deeply into the specific behaviors that research shows can reduce your risk of developing chronic disease, live a long life, and a healthy one at that. The blue zones are the regions in the world that have the highest number of centenarians, people who live to 100 and beyond. And it gives the insights into what those people do to improve their health. So please join us for our final lecture on the blue zones so we can figure out what we can do to reduce our risk of developing chronic disease and live a long and healthy life. Take care.